tables were turned and the majority of those hurting their partners were women and those being hurt were men, would the model be the same? Would the model say progress, not perfection? So I'll do just a quick answer to that. So I have treated and treat female sex addicts, female sex and love addicts, and I want to say that the model is absolutely the same. There is no difference.
There might be a societal perspective that's different. I mean, we talk about like the way that society looks at it. If you have a woman who her addictive behavior is exhibitionism, and she's, you know, standing in her bedroom with the curtains open, changing clothes, and you've got an addict, a male addict who's walking by, who's sort of a voyeur, and he's watching her, and people catch him, she's going to get an apology. He's going to get, you know, in trouble. And that's the way it's going to be perceived when she, you know, if she has her addictive process going on related to that exhibitionism, she's not getting the help that she needs. We also have a history of movies where women, adult women, are sort of bringing younger men into manhood, and part of that is often being sexual, and those movies are seen as rites of passage and are okay. And if you flip the genders, they're viewed as very, very creepy. So there's a societal piece that I think in some ways from that perspective gives women a little bit more of a pass. Although historically men do not react nearly as well to women going outside the marriage and cheating and men are typically giving a little bit more of a pass there. So there's these societal pieces that sort of weigh gender differences in there. But I agree with you, Wendy, that from an addiction model and from the treatment model that we're working on, there is no difference between, you know, what we hold female addicts accountable for and what we hold male addicts accountable for, and the expectation of figuring out sobriety.
I would add the piece of the way we treat the different sensitivities, but the overarching treatment protocol or modality is the same. But I think there's a bit of a difference in the interventions. Like I'm thinking of with female addicts, they tend to be more process oriented than task homework oriented in their groups. You know, there's a bit of a difference between male partners and female partners in the way they express anger. Betrayed partners still have a traumatic overarching treatment approach. And with female and male addicts, there's the overarching addiction protocols. So I don't think if the tables were turned, we would treat them from a macro level differently.
But I guess I'm still, so I this is a big caveat. I don't work with female sex and love addicts. So I'll defer to you, Wendy, and you know, any of you all who do that work. But we do know that there is still patriarchy and misogyny. So we do know men and women are treated differently. So I know we're saying theoretically there's no difference in model, but is that fully true? I don't know. It just seems like it'd be hard to say there's not some of that kind of gender-based stuff that plays out.
Right. Well, and I'm wondering if her question is, if you have a woman that's acting out sexually, is the husband going to be much, much less tolerant and basically say, you know, you're never to do this again? Where I hear her framing it as, but if you have a man that's acting out, then we say, oh, progress, not perfection. Oh, this is, you know, maybe if I'm hearing she's saying, oh, this is, we allow men passes
where women don't get the same passes that men get.
But I mean, I think it depends. I mean, if you're talking about partners, you're going to have some male partners that are going to be tolerant. You have some male partners who aren't. We see the same thing with female partners. Some female partners are very understanding and tolerant and resilient when it comes to sort of the struggles of relapse, and some female partners are not. If you're asking from a treatment perspective as the clinicians and as the treatment field, I don't think that we see it differently between a female addict or a male addict. I think we see them as addicts, and the ultimate goal is the same, and the progress, not perfection, is still the understood thing, even though the partners may have a different feeling about it.